Hello, I'm Dr. Anthony Gonzalez. I'm a general, robotic, and bariatric surgeon down here in South Florida. I'm born and raised in Miami, went to college at the University of Miami, and went to medical school at the University of Miami School of Medicine. I've been in private practice here in South Florida at Baptist Health since the late 1990s. I am the chief of surgery at Baptist Hospital in Miami. I run the bariatric surgical program as the medical director of the bariatric surgical program for Baptist Health. And I'm the founding program director of the Minimally Invasive and Bariatric Surgery Fellowship. That is a fellowship where surgeons spend a year with me after residency to learn advanced robotic and bariatric surgery. Today, my practice is 70% general surgery. General surgery involves conditions like hernia, gallbladder, reflux, and even colon surgery. And 30% of my practice is dedicated to bariatric surgery or weight loss surgery. All of these operations are done through minimally invasive robotic approaches as my experience as a robotic surgeon. Now, let's discuss a few common conditions that I deal with on a daily basis. Today, I'm going to be talking about the gallbladder and gallbladder disease. What is the gallbladder and what is its function? The gallbladder is a small organ like the size of a pear that lives under the liver on the right side of your abdomen. The gallbladder is a storage organ. The gallbladder stores bile that's produced by the liver and helps you with the digestion of fatty food. Every time you eat, the brain signals a hormone that causes the gallbladder to contract and empty and help you with the digestion of your meal. Now, there are many diseases that can occur of the gallbladder. And when the gallbladder stops working for many reasons, because of dieting, because of genetic factors, because of pregnancy, because of hereditary issues, the gallbladder can develop dysfunction and lead to gallstones. And gallstones are one of the issues that we see with the gallbladder. Other issues we see with the gallbladder are gallbladder polyps, which are growths of the gallbladder. And of course, polyps, as you know, and gallbladder polyps can eventually lead to gallbladder cancer. Now, when you have problems with your gallbladder, what symptoms can you have? Well, gallbladder symptoms are bloating, indigestion, what we call dyspepsia, gassy feeling, and intolerance, even intolerance to fatty foods. Now, sometimes there are no symptoms of the gallbladder. Maybe you have a study done, an ultrasound during your pregnancy, or a CAT scan for another reason, and they incidentally find gallstones or polyps of your gallbladder. And so obviously, disease of the gallbladder can show up even if you don't have symptoms. So what is the treatment of the gallbladder? Well, obviously, medical treatment of the gallbladder exists for polyps. If you have polyps of your gallbladder and the polyps are small, smaller than 8 to 10 millimeters, then I'm going to recommend observation, no treatment, and just follow-up ultrasounds. If those polyps are causing symptoms, then we may recommend removal of your gallbladder. Other treatment of the gallbladder for patients that can't have surgery could be medication. Ursodeoxycholic acid is a medication that we give patients who are very elderly and cannot have surgery for their gallbladder to try to dissolve the gallstones. But this medication requires lifelong medication. And so this is not an option for patients that can undergo surgery. Now, if you have a disease of the gallbladder, your gallbladder is not working, you have gallstones, or you have polyps, then surgery may be needed for the gallbladder. We don't remove the stones, we can't remove the polyps, we have to remove the gallbladder in its entirety. Now, removal of the gallbladder is done robotically. Robotic surgery will be covered in another video, and I will refer you to that video for information on robotic surgery. But surgery for the gallbladder will be done robotically, and that could be done through single-site robotic surgery or multi-port robotic surgery. Single-site surgery means that we do the gallbladder surgery through one little incision, 1 inch in size, and we do that through the belly button. Multi-port robotic surgery means that we will do that operation through multiple little holes in your tummy. All of these are done through minimally invasive robotic approaches. These operations take 30 minutes to do and you will go home a few hours after surgery. Now, in these operations, we give you a medication called indocyanine green, and that is a firefly technology that helps us identify the structures before we even touch them. And that medication is given to you in the pre-operative area right before you go into surgery. Now, it's important to know if you have iodine allergy, because that medication has 5% iodine. And so we would need to pre-medicate you prior to the operation. So please let us know if you have iodine allergy. Now, these operations, as I mentioned, are done robotically. They're done at the hospital. They take 30 to 40 minutes to do. You go home a few hours after surgery. If you have more medical condition or advanced age and you need to stay in the hospital, we will keep you in the hospital. But the majority of patients go home within a few hours. You'll be up and around walking, moving, talking. You'll be able to drive in a week, usually return to your office activities in a week. You'll be able to exercise in 2 weeks and no heavy lifting for 1 month. Now, what complications can you have from gallbladder surgery? Well, one of the things people always worry about is, am I going to miss my gallbladder? Do I need my gallbladder? Well, if your gallbladder has disease, you're not going to miss your gallbladder because the body has taken over those functions. Now, complications after surgery can be bleeding and infection. Obviously, bleeding, very low risk unless you're taking blood thinners, and we could talk about that individually. And infection or leakage of bile is a rarity as well, except when you come into the hospital with a gallbladder attack. That's why we always advocate for what we call elective planned surgical procedure for your gallbladder. So gallbladder disease is very common. We do hundreds of these operations every year. Obviously, if your gallbladder is giving you an issue, we could discuss options for you, whether it be observation for your polyps or the need for robotic surgery to deal with symptomatic stones that are bothering you, or gallbladder disease. Once again, Dr. Anthony Gonzalez here, educating you on another surgical topic. Thank you.